So obviously things go wrong when someone has a malignancy, a tumor, let's say. Your body has failed to find that malignant cell and destroy it. Or there are a number of diseases known as autoimmune diseases, which means that your body, all of a sudden, for reasons that nobody understands, starts destroying parts of itself. So say rheumatoid arthritis, all of a sudden your body reacts to your joints and causes inflammation and actually starts destructive processes. So what our laboratory is looking to do is to modulate the immune response, either to enhance it in the case of a tumor. How can we enhance this and make your own immune response destroy the tumor, which it should have done in the first place? Or in the case of rheumatoid arthritis, how can we damper it a bit so that it can take care of the foreign matter, the bacteria and the viruses, and yet not destroy your joints? And that is what our laboratory is trying to do, is to modulate the immune response to clinical advantage. So what does this have to do with blood banking? It turns out that these white cells that we're studying are actually detrimental for transfusion products. What happens when you donate a unit of blood, you donate a lot of white cells along with the red cells. And if I were to donate a unit of blood and it was given to you as a patient, my white cells are going to recognize your entire body as foreign. And that is not a very good situation. If you're ill, you need a transfusion, having this massive immune response is not a particularly healthy situation. So the blood banking industry has had to figure out ways to eliminate the white cells from blood products. And in most institutions, most blood banking institutions, the white cells are removed and tossed away. But obviously, in this situation at the Stanford Blood Center, we have laboratories that are looking at white blood cells. They're studying. I mean, this is gold to us to have this reagent downstairs that we can use for our studies. So these specimens are de-identified. There's no names that come up. All that comes up are healthy white blood cell concentrates. And we can use them for our studies. We can look at the interactions of different types of white blood cells, how they communicate, how they interact in order to keep you healthy. Obviously, you're a healthy volunteer. Or we can put them into our assay systems and compare the healthy blood with the blood of patients if we're doing assays to see what's going on, why are these cells not functioning the way they should, and how can we intervene in order to keep everybody healthy. So when you donate blood at the Stanford Blood Center, there are two key points. One is that you are helping not only people that are in the hospital today and in the hospital tomorrow, but you are helping patients of the future by donating blood that will be used for research, your white blood cells.